This is my audience of 5. As you see, I've handed you some handouts, so as I'm going along with my speech, you can kind of see visually what Alzheimer's does to the brain and the steps it goes through in the process. Today, I would like to take you on an exploration of one of the most mysterious diseases known as Alzheimer's. Could you imagine waking up one morning and can't remember where you are, or even worse, one of your own family members' names? This could be a direct sign that you or a family member might have Alzheimer's disease. You see, Alzheimer's disease is a form of dementia, which means that it affects certain functions of the brain such as memory, logic, and everyday bodily functions. After working as a CNA in the medical field, I am all too familiar with this disease. Not just working with Alzheimer's patients, but having a family member, my grandpa, who was diagnosed with Alzheimer's and passed away in 2011. He is my real inspiration for this topic. I would like to educate you about Alzheimer's, as it is important to know that this disease is currently on the rise in America and the rest of the world. It is important to bring awareness, and I feel people should learn as much as they can about this disease, because as you age, your chances of becoming an Alzheimer's disease patient increases. Alzheimer's was first discovered by a doctor named Alois Alzheimer's, who discovered this rare disease in 1906. His first findings were unusual growth of fibers in the brain of a woman that died from unknown mental illness, which brought concerns and more studies to follow. People in today's society do not realize just how severe this disease really is, or realize how much of a risk there is of developing this disease. Did you know that 1 in every 6 seconds someone is diagnosed with this disease? The numbers are outrageous and only growing. The Alzheimer's Association has estimated about 22 million people around the world to currently have this disease. Learning more on the broad topic, I found an interesting fact to share that changes in the brain will take place and occur up to 20 to 40 years before the patient shows any symptoms. Today, scientists believe that they know exactly what causes it to occur, and after studies found that it is directly caused by proteins in the brain that go terribly wrong. These proteins form clusters inside the brain, which produce a toxin that affects the nerve cells. These nerve cells are then lost, and this affects certain parts of the brain that control certain functions. 2 parts of the brain directly affected are known as the hippocampus and the cerebral cortex. These parts of the brain are critical in everyday life of our central memory, reasoning, language, and most of all, our bodily functions. This disease takes a very slow path in its development. It may just start out with short-term memory loss. This means that a person with Alzheimer's may forget little things, like what she ate for dinner last night. These symptoms can be overlooked as just part of the aging process. But as the disease progresses, however, the symptoms get much worse. Sometimes people with Alzheimer's forget where they are, and they can't even forget what they're doing halfway through a simple task like making coffee. Believe it or not, people can eventually start forgetting to do their everyday tasks, such as brushing their teeth or combing their hair, and can even forget when to go to the bathroom. After a while, a person may need 24-hour daycare. The final stage of this disease will kill the patient. The brain will lose the ability to command certain organ bodily functions, which in my grandpa's case, his heart stopped functioning. Every patient will eventually meet their similar doom. The worst part is that nothing can be done about this. There is no way to stop this disease from taking its path. There are no discovered cures for Alzheimer's disease, nor is there any vaccinations. There are, however, precautions that can be taken to lower the risk and development of this disease, and the treatments to slow the progression of AD. Some of these preventative measures that can be taken include lower distress levels, as this has been proven to cause plaque buildup. And if you have depression or high stress levels, then the use of antidepressants can help in an AD sense. Although no known cure has been found, there are currently 2 drugs in the treatment of Alzheimer's disease. These drugs are only effective during the first year of this disease. The drugs are called Coganex and Aricept. Both of these drugs work by increasing a chemical in the brain that works with the memory. They do not cure this disease, but they do produce some improvements in the patients. The most difficult part of this disease is that a person does not need to have this to suffer from it. The caregivers are doomed to watch his or her family slowly turn back into a toddler-like state. The caregivers are faced with being re-educated every few months. The caregiver must learn to deal with new changes that occur with a patient with this disease. Eventually, the caregiver is responsible for the following: makeshift remedies, negotiating impossible requests and insults, financial responsibility, shopping, cooking, dressing, and bathing. This can cost a caregiver tens and thousands of dollars. The job of a caregiver is a very tolling one. This person needs to totally devote his or her to this job. According to the Alzheimer's Association, there was 14.9 million family and friends that provided over 16 million hours of unpaid care to those with the disease. This disease is obviously a horrible and mysterious one. It can rip families apart, and there's nothing that can be done about it. Hopefully, one day, a cure will be found. But in the meantime, Alzheimer's disease has a total control over a person who is afflicted with it. It also has control over the family of the person afflicted with it. It has been said that if there is no cure found by 2050, then the estimated number of diagnoses of Alzheimer's will increase from 1 in every 66 seconds to 1 in every 33 seconds. Almost everyone in the country has some sort of tie to this disease. And this is why research should be done in hopes to finding a cure.